Hello. Patient Shelby Knodel, 25-year-old female, comes in today complaining of shakiness, fainting spells, multiple fainting spells, fatigue, anxiety. Patient states that she often has these episodes of shakiness that are accompanied with irritability, anxiety, racing heart rate. If she eats, she feels better, but if she can't eat fast enough, she feels very lightheaded, starts seeing spots. Let me see. The patient complains of racing heart rate and dizziness before eating, usually 2 to 3 hours, and then she starts feeling dizzy. Onset of symptoms about 5 to 6 years, she started noticing the fainting and things like that. Symptoms worsen the longer she waits to eat. She gets shaky, dizzy, clammy hands. The severity of symptoms often are treated fairly easily. Whenever she eats, she feels a lot better. But sometimes whenever she can't, or it's in the morning and she hasn't eaten all night, hasn't drinking anything, she goes and has fainting spells sometimes. One of them landed her in the ER. She was seen at Northern Louisiana Medical Center, where they didn't do much for her. They just told her that she was dehydrated. For the review of symptoms, systemic, she has no fevers presently, no chills, no aching. For head and neck, no injuries, inflammation, or pain. Eyes, she has glasses, but no eye pain, inflammation, injuries. Pulmonary, negative for cough, shortness of breath, and wheezing. Cardiovascular, negative for pain and injury. Neurological, negative for pain, injury, dizziness at the time of the visit. No confusion, she knew where she was. For mental health, she does have a severe anxiety disorder, which probably doesn't help things. For skin, she does have eczema locally on the abdomen region. For her past history, her current medication, she's on a birth control pill, Junil FE 1.5. That's my cat. 30 days. She takes melatonin nightly. Cat, come on. Vistaril is for anxiety. She takes it as needed for anxiety, sometimes nightly. Allergies, Bactrim antibiotics she's allergic to. She gets red and itchy, but it's not a severe allergy. As for surgical history, she had a LEAP scope procedure back in January of 2020. For family history, she has a family history of COPD on the paternal grandmother's side, myocardial infarction on the maternal grandfather's side, Alzheimer's for the maternal grandmother, and that's about it. Social history, patient doesn't use alcohol or tobacco. She used to smoke marijuana maybe 3-4 years ago. She was not sure. Patient exercises 2 to 3 times a week. She drinks plenty of water. She does work as a medical receptionist, so she sits most of the day. She has a pescatarian diet. She only eats fish, no red meat, no pork, no turkey, nothing like that. As for our physical exam, her vitals looked good. Blood pressure was normal at the time of the visit, 120/80. Heart rate, 82 beats per minute at sitting. Temperature, 98.8. Her weight, 134 pounds. Height, 160.02 centimeters. Oxygen saturation was at 100%. As for general appearance, she was well nourished, awake, responsive. She didn't have any dizziness or she wasn't seeing spots. She had just eaten previously to coming into the office. Her head looked normal, eyes, she has myopia. For her back, she does have some back pain due to her occupation. Pulmonary, her respiration rate and depth was within normal range. I didn't hear any wheezing or cough. For cardiovascular, her heart rate and rhythm were within normal range. No, I didn't hear any heart murmurs. Abdomen, no abnormalities were found. neurological, negative for mental deficits. Patient was anxious at the time of the visit. Patient has a diagnosis of severe anxiety. We plan to run some lab tests on her because we believe this might be a blood sugar issue. She doesn't have any diabetes within the family history, so we're ordering a blood glucose on her, hemoglobin A1C to see the last 3 months of her blood sugar levels. I communicated to the patient to eat small meals throughout the day as much as possible that are high in protein, cheese, nuts, beans. Avoid high sugary foods that are going to fizzle out during the day. Eat if they feel shaky every 2 to 3 hours. Don't drive or operate machinery if they're feeling dizzy.